such a good attendance. Thank you all for coming. So this is, I think, the first event for RHN's Women's Network. The network has been working kind of behind the scenes on lots of different projects, but a couple meetings ago we spoke about how nice it would be to have an inspirational woman come and speak to us about their career journey. And so that's when I reached out to Steph Edusei to kind of invite her to come to the RHN and tell us a bit about her career journey, which she'll be doing for us today. So she'll talk for about 20 minutes and then there'll be 10 minutes for a Q&A. So if you have any questions, please do ask. And if you are interested in joining the Women's Network or getting involved in it, please let me know. Okay, thank you. Thank you. Now, two things. First of all, I need to make sure everybody can hear me, because I'd rather not use a microphone if I don't need it. So if at any point you can't, wave, and then I'll kind of talk louder or get a microphone. And also I can talk. So you may recognise from my accent I'm not local. I am a Geordie. I'm from Newcastle upon Tyne. I will try to put on my best telephone voice for you all today and not to use too many Geordie terms, but they will come out. So, is this it?
Yeah.
Thank you. So I want to just kind of talk about my career in health, and the reason I say in health is because I actually did some stuff before I started in health. I was a barmaid, I worked in a building society, I did basic kind of clerical type and service type jobs, but started as a clerk typist in the NHS in 1996. And I kind of fell into that job. My mum was a medical secretary, my mother was a medical secretary, and they needed somebody for a 3-month short contract. I'd just been made redundant, and my mum said, oh well, our Steph's free, and I ended up getting the job. And I'm no word of a lie, the interview, they asked me a couple of questions, and they said, oh well, Steph's a good secretary, so you'll be fine. I don't know if people come to the door, just wait a minute. But actually, very shortly after joining that job, I realised I loved it. The job I'd been made redundant from was customer services for an office furniture company. And people would call me up and they'd go, there's a scratch in my £2,000 desk. And I'd go, oh. But all of a sudden I was working on a liver unit, and I was going home knowing that there was a 21-year-old somewhere in the country who needed a liver for a super urgent transplant. And that mattered, and it kind of grabbed me. The problem was it grabbed me 2 weeks after the closing date for the job I was covering. So I didn't get that. But I became what they call a relief medical typist, or as we say in Newcastle, a flirter, because you float around the hospital. And then I became a medical secretary. And I was a medical secretary in cardiothoracic surgery, then went on a secondment into medical staffing when I was working on junior doctors' hours, back in the days when doctors could work kind of 7 days, 24/7, and I brought them right the way down to 56 hours a week. And then I went on to the management training scheme, the National NHS Management Training Scheme, and I became a graduate trainee. So I did that for a couple of years, went into operational services management in a hospital, then moved into a service improvement manager role back in the hospital that I'd started at. I then became an acting director and manager, so I was managing perioperative and critical care and waiting lists. And then I left hospitals, which is where almost all of my experience had been, and I became assistant director of operations at the North East Ambulance Service. I then became an assistant director of commissioning. I was seconded out of the ambulance role into a commissioning role, which was really weird because it was a secondment, so I was still on call for the ambulance service, but my commissioning role was commissioning the ambulance service. So one day I was on this side of the table, and on the other day I was on that side of the table. I then was seconded again into a role as Whilst I was doing the assistant director role, I also set up Northumberland Clinical Commissioning Group. And then they wanted me to stay on, and they created a role for me because they wanted me to do governance. And I have the most fantastic head of governance now. She's amazing. And she does a fantastic job, but it's not my thing. I can do it, but it just doesn't light my fire at all. So I didn't want to do that. So what they did was they put governance with engagement, with organisational development and with planning, and gave me a strategic head of corporate affairs role. I did that, and then at that point I decided it was time for me to leave the NHS. I set up my own business doing management consultancy and coaching, and I also took on a role as Chief Executive of Health Watch in Newcastle. In case you don't know what Health Watch is, it's a health and social care watchdog. It's a statutory organisation, but we're there to make sure that patients and the public are listened to when you're planning and providing services. And then, almost exactly 5 years ago, I became Chief Executive of St Oswald's Hospice. That's my career in a little pot. This was last year's Black History Month theme, Reclaiming the Narrative. And this is actually me. I'm also a dance teacher. I teach ballet and tap and performing arts and a couple of other things. And this is an orphanage that my family supports out in Ghana, because I'm half Ghanaian. And I was out there, this is 2018 when I was there, and I taught the kids ballet. And what I love about this photo is, at the back there, those lads there are about 17, 18, and they love doing ballet. And they love doing ballet because nobody told them that they weren't supposed to. Nobody told them that that wasn't for them, and they just had great fun doing it. But I'm going to reclaim my narrative. So this is me. Born and brought up in the northeast. This is me and my grandfather, my granddad's back garden. And I was 2 years old then. And my mum describes me as boisterous, cocky, she says, and I'd say curious, and I was full of fun. I was happy, and I was just into everything, like 2-year-olds should be. This is also me. So in this picture, I'm probably about 10, maybe touching 11, but probably about 10. I was tall. I've been 5'4", 5'5" since I was 11 years old. So I was almost always the angel. I could never be. This girl here, I'm still friends with now, Angela. She was Mary, and she had blonde hair. And I was never allowed to be Mary. And when my daughter was offered to be Mary in the nativity at nursery, she turned it down, and I've never forgiven her. But, you know, I was confident, and I enjoyed life, and I was surrounded by friends and people that loved me. And then this is me. So this is me, and I'm probably now about age 14, maybe 15. And this is actually taken from our local paper back then. And we had all won a competition for story writing. And if you look at me there, I'm not in the front anymore, and I'm not confident. And something happened between me being that confident 2-year-old or 10-year-old and me being a very unconfident 14-year-old. The strange thing is, nobody knew I wasn't confident at 14. If you speak to anybody who knew me back then, they would describe me as confident. They would describe me as right at the very heart of things, but I felt like I didn't belong. I felt like I wasn't good enough. I felt like people were tolerating me. So my actual career, I became an operational services manager, and this laid down some really bad behaviour for me. My manager there had no life. I'm sorry to say it, but she had no life. She just worked. That was her entire life. And she basically, if we left before she did, at 8 o'clock at night, then she would look down on us. And I was run ragged. My life was go to work, come home. My food intake was normally a Kit Kat and a can of pop. And then in the evening, I would have half a bottle of red wine and some nuts because I was too tired to have anything else. So it wasn't a great experience for me, and I felt like I was constantly trying to protect the staff below me and protect them from the managers above me. Then when I became acting directorate manager, I actually applied for the directorate manager job. And I was told after the interview that I was above the bar, I was appointable, but there was just somebody better on the day. And I kind of went, okay, I can understand that, it just wasn't good enough. And then I went off on holiday and I came back 2 weeks later and the theatre staff were so excited. They went, Steph, she's not taking the job, they're going to give it to you. And I waited a week. And then the personnel manager came to speak to me and said, so we're going to go back out to advert for the job and you'd be more than welcome to apply. Oh. They didn't want me to do that job, but it was clear. So I said, thank you very much, I won't be applying. And that's when I moved on to the admin service. I actually took a sideways step. It was actually a downward step. I went downgraded, but the pay was the same. But the job was re-evaluated and I went back up. But as Assistant Director of Operations, I went on to a leadership development programme, a national programme for black and minoritized leaders. And as part of that, the admin service was supposed to second me into a director level position. And they didn't, but they kept promising me that they would because they needed me to stay. And after a year of them promising, I organised my own secondment out of the organisation into that assistant director role. And then, as I say, I went into the strategic head role, and it was at that point that my will was broken because I was working in an organisation that didn't share the same values as me. And I was crying a lot. And just getting very angry a lot. And I decided it was time for me to step out, and I was fortunate that I'd already started to plan setting up my own business, but the job at Health Watch came up. And this is me actually when I was Assistant Director of Operations. I was going through boxes in the loft and found the newspaper that this is from. The picture is this big in the newspaper. This is me trying to be a white, middle-aged man. Because everybody at the ambulance service and the level above me, the directors, were all white, middle-aged men. The pictures of them when I applied for the job, the pictures of them on the website was them in white shirt, grey suits, grey hair. They were grey. I didn't wear much makeup, I tended not to wear jewellery, I didn't wear colour. I dressed in a uniform. It was like a costume almost that I would put on and I'd go to work. I was also overweight and unhappy. And all I can see when I put this picture is somebody who's really unhappy. And now I'm not. So this is the first lesson that I want to tell you, and it is really simple. You are enough. You are enough. And I do not care if you are a chief executive or if you're homeless on the street, you are enough. And do not let anybody ever tell you that you are not. You don't have to know everything. You definitely do not have to be able to do everything, because I can't. You don't have to be right all the time. You are allowed to make mistakes. But you are enough. And you are good enough. And one of the things that I've realised around this is that women, and particularly people of colour, ethnically minoritized people, are told all the time that we are not good enough. You've probably heard the term imposter syndrome. I don't use that anymore, I use the term imposter phenomena. Because imposter syndrome is now used and it's really weaponised against women. Because you'll be sitting and someone will say to you, so I'm going to pick on you, you have imposter syndrome, you should do something about that. As if somebody's saying to you, you know, you've got a growth on your neck, you really should get that looked at. Because it's your problem. You need to sort that out. And it's almost like, oh, so I've got something else that I've got to beat myself up with because I've got imposter syndrome. It's not an illness, it's not a disease, it's an experience that we have when we believe we're not good enough. I was constantly waiting for someone to find me out and say, actually, there was a mistake and you shouldn't have this job. Constantly. And because of that, what I would do is I would just rush about all the time. I would do as much as I could, I would work as hard as I could, I would say yes to everything. Because if I made myself useful, even if what I did was not good enough, it was okay. And I would do a lot of it. And also, if I moved really quickly, nobody could see what I was doing. So now I've worked hard on my feelings and my feelings of imposter phenomena. And what I now know is that I am good enough. And it does rear up sometimes. Let's just talk about as it came in. Sometimes it'll rear up, but I recognise it for what it is, and I know how to shut it down again. And I actually get curious about it. And one of the things I've realised recently is that sometimes it's not you at all. It's everything around you. So one of the reasons that it kicked in with me when I was about 12 is because I was being told, I don't fit in. Go home. You don't belong here. You want to play football? That's not for girls. You can't do that. So there's lots of messages in society that are telling us that we're not enough and that we don't belong. So I kind of nowadays, when I feel that feel of imposter syndrome, I go, oh, what's that about? And I'm always mindful of, is it actually not about me at all, but is it I'm picking up on things, because we are incredibly insightful and we will pick up on messages that are being sent to us. Okay, so next one is, as one door closes, another door will open. I have had so many career setbacks. So when I was working for the clinical commissioner group, I wanted to get back into hospitals. I wanted to be a hospital chief exec. That's what I wanted to do. I was desperate to get back into hospitals. And I applied for job after job after job. I went and had conversations with people, and I got told things like, oh, well, you're really good at what you do. You should stay with governance because you're really good at it. I would be told things like, you've been out of the acute sector for too long. So the fact that I had experience of ambulance services, of commissioning, that didn't matter, that didn't bring value. There was always a reason why I wasn't good enough. But actually, had I taken any of those jobs, I wouldn't be where I am now, and I wouldn't be as happy as I am now. So I think whilst when you go for something or you want something to happen, it doesn't happen, it's heartbreaking. And I talk about it, I'm in a hospice, like grief. You have to mourn that. I had to mourn the fact that I'm not going to be a hospital chief executive. I'm now really happy that I'm not going to be a hospital chief executive. But I had to go through a mourning period of leaving the NHS. But actually knowing that there is something coming. And I've had something happen to me recently where quite a big door was slammed in my face in a different role that I had. And whilst it was really, really tough, I just kept saying to myself, another door will open. And about 3 have. And I've walked through 2 of them because they're so much more fun. Next lesson is about surrounding yourself. So have you ever heard the term of surround yourself? You are the sum total of the 5 people that you spend the most time with. It's not true, but it's kind of true. So it's more than 5, and it's not just people. So I used to listen to the news constantly, just all the time. I'd listen to the news in the car, I'd listen to it, it would wake me up in the morning, and I don't know if you've noticed, but the news is rarely happy. So I was surrounded by really depressing news. I was working in the NHS, which was not the happiest, most uplifting place to work. I was in a really bad relationship, which was as a result of the imposter phenomenon, that I accepted that. I used to watch a certain soap opera. I called it Emma Dallas. And I used to watch it on a Sunday morning. I used to record the omnibus edition, and that was my little treat on a Sunday morning. I would watch it. But it's all betrayal and death, and any soap opera is. And it was just, I suddenly realised everything in my life is negative. So I went cold turkey, no news at all for 2 years. I listened to uplifting podcasts, I did uplifting playlists, I sought out new people, I got rid of the partner. I did all kinds of things I did to kind of cleanse my life. And I now really carefully curate the people and the things in my life to make sure that I've got enough positivity so that I can be a positive person. And that's not to say we don't have problems, because of course you do. I've got a 20-year-old daughter, a 23-year-old stepdaughter, and a 19-year-old stepdaughter. I'm going to have a lot of challenges in my life. But actually, because I've got the rest of the stuff, it helps me. It helps me work through that and to cope with those challenges. So these are actually two of our bereavement workers who work with children, and they're incredibly warm and positive people. And I just love walking through our reception and having a giggle with our staff and actually our patients quite often. This one's really important. How many of you would like a seat at the table? Because all I'm going to say is, be careful of the table that you choose to sit at. So, I was flattered. I was invited to apply to sit at a table, and I was like, oh my God, look at that table, it's amazing. And I applied, and I got a seat at the table. And I then spent the next 2 years being gaslit, ignored, and just generally had the worst possible time. And I still possibly would be sitting at that table if I wasn't asked to leave the table. But what that allowed me to do was to really look back and reflect and say, when I was invited to sit there, what was the language that was used? And it was really clear that what they wanted was a brown face around the table. And I've read the book, and in the book I say, and I'll stand by this, what they thought they were getting in me was someone just like them. But I had a bit of a tan. That's what they thought they were getting. They didn't recognise that with me comes not only a whole load of charity sector experience, but also a whole lot of cultural experience. And as an EDI advocate, I'm not going to sit there and keep my mouth shut. So when you're looking for a table to sit at, make sure it's a table that is going to feed you and not starve you. And the other thing I will say is, do not believe the myth that there are only a certain number of seats at the table. Because that is something that we are told, so that when we get that seat, we go, oh, it's full, you can't come here. And you see that behaviour, people get their position, and then it's almost like they're protecting it from anybody who looks like them, or anybody that sounds like them, or thinks like them. There are plenty of seats at the right table. And if there aren't, we make our own tables. So really think, yeah, it's great to get those opportunities. And really think about the table you're being asked to sit at. And it's not to say don't do it, but go in there with your eyes open and know what you're getting yourself into. Okay, one last one. So, this picture of me, grey woman, middle-aged grey white man. That's not me anymore. And one day I bumped into somebody that I used to work with when I was a management trainee. And she'd left the NHS and she was doing nail technician. And I'd just been over to Ghana and I'd had acrylic nails done and my nails were in the right state. And she said, look, Steph, you keep saying you're going to come and get your nails done. Come and get your nails done, I'll sort them out. So I went and I had a very nice pale pink on my nails. And I thought, then I had a lovely chat with her. So I said, I'll come back in a few weeks' time. And then one day I was sitting there and I went, I might have like a bright pink. And then I had green. And then I had bright blue. And I had purple and I had red. And then I started wearing colour. Because colour is part of my cultural heritage. But actually, colour looks really good on me. And that was my little bit of naughty. So that's my final lesson to you. Find your little bit of naughty. For me, it's going into meetings surrounded by people who are all wearing monochrome in a bright, I've actually, your picture up there, I've got dresses that colour. Bright green, bright blue, bright pink. And I will walk in because I am going to stand out no matter what I do, because of the way I look, because of the way I sound, because of the way I think, I'm going to stand out. And when I realised that because I stand out, I'm outstanding, it made me feel so powerful that I thought I'm going to stand out for all the right reasons. And when I started wearing colour, and embracing that again and being a little bit naughty and then saying, oh, how else can I be a little bit naughty? I turned back into me. I turned back into her. And I'm probably closer to that 2-year-old kid than I've ever been now. Thank you. I will just say to you, there's a couple of QR codes. The top one is my own personal link tree, and in a shameless plug, I have a book that's going to be released in about 3 weeks' time, which is a little book of leadership lessons. So it's taking some of these lessons and more, and just stories from my life and saying this is what I've learned and it might be useful for you.
Great, thank you so much. Thank you. I just wanted to invite anyone to ask any questions or any comments or feedback.
Yeah, I've got a question about imposter syndrome. So when did you realise when did you recognise it in yourself?
So I was told I had imposter syndrome by a coach when I was on the management training team. So I was probably about 29, and I'd never heard of it. And she said, you've got imposter syndrome, you need to get this book, and it was about gremlins. So this was my imposter syndrome had imposter syndrome, it was terrible. So I got the book, and I read on the toilet. So I was sitting reading this book, and I got to the end of the first chapter, and it had an exercise to do, and I went, I haven't got time for that, I'll do it later. And I put the book down, never went back to it. And I then probably wasted about 15 years dealing with imposter syndrome. I didn't know what it was, didn't really understand what it was. But I would then, the reason I say my imposter syndrome had imposter syndrome is, I would sit there and I'd go, oh, I messed that up, so, and then you go, no you didn't, and you know you're enough, and you go, oh, who do you think you are? So I'd be having these conversations with myself and beating myself up because I had imposter phenomena. So it was just, I mean, it affected every part of my life, but it just, looking back, I can see it as a teenager. And I think a lot of, particularly girls, get it very, very young. I see it in the kids I teach dancing, unfortunately.
First of all, thank you so much for a fantastic presentation. So I think it resonated with pretty much everybody in the room, so thank you so much. Really inspirational. I have a question because as part of the Women Network, we sometimes look at healthcare and find how misogynic healthcare could be. Now you're a chief executive. What step have you taken, what are you doing to kind of break that and make healthcare welcoming?
It's really curious, I think, because my organisation is probably a little bit different in that it's a charity for a start, but our entire leadership team, senior executive team, apart from one, is female. And I did actually try to change that. So one of the team left and I replaced them. And I went to the recruitment people and said, I really want some diversity. And by that I include men. But we actually ended up, the best person was a woman, so she got the job. And we didn't really have that many men apply. And I think for me, it's about really, the way that I talk with women is important. Because it's really important that, as you say, a lot of this stuff, we don't talk about things like imposter phenomena. I didn't talk about it for years because I thought if I said to somebody, well, the thing is I don't feel like I'm good enough and that I'm, people think I'm a fraud, I thought somebody was going to go, well, I wasn't going to bring it up, Steph, but now you mention it, so we don't talk about these things. So I make a point of talking about stuff. I make a point of talking about imposter phenomena. I make a point of talking about periods. I make a point of talking about being a mother and what that particularly brings. And I was a lone mother for a long time, so what that means. So I talk, and I try to create an environment where people feel that they can talk about some of the stuff that's affecting them. And the thing is as well, I know when I'm doing that, I'm not just helping the women, I'm helping the men. So to me, it's about creating that environment, but also it's about challenging it and creating an environment where people can challenge. So one of the ones I keep saying, apologies to the nurses in the room, I don't want to have sisters anymore. I do not want sisters. That is massively gendered language. We have a sister and you have a nurse in charge or a charge nurse. And to me, a charge nurse sounds more important than a sister. So I think there's stuff like that that's actually just so ingrained, and I haven't managed to get our team to kind of do that one yet, but and they talk about the blue dresses, and it's stuff like that in healthcare that I just think we just haven't do. But I'm very fortunate as well that in palliative care we're very holistic. So when a patient comes through the door, our staff, including our medical staff, are really good at listening to the patient. And I think that doesn't happen enough in healthcare, and particularly with women in healthcare. Our concerns are disregarded all the time.
Thank you very much.
Any other questions?
Have you found that other women tend to be worse at making you feel more like an imposter than, say, male singers? Because our profession is very female dominated, so it tends to be more female bullying and...
It can do. I mean, certainly in the early days we had a lot of macho women. It was a very macho, masculine environment in the hospital, and I used to say that some of them outmen the men. But I think that was because they, looking back, wise old woman now, that's what they had to do to get to the positions of authority in that environment. And that's why that thing about the table and the scarcity of places, it's really important that we do not buy into that and we challenge that. Because I've worked in and led some teams that are mainly women that have been amazingly supportive and encouraging. And that's, I'm trying to teach that to the girls, that, you know, that this whole thing of, another program I used to love was The Real Housewives, and then I realised just how horrible it is. It's horrible, and those women are horrible to each other. And I was like, I can't buy into this anymore, because it's teaching us that that is how women are to each other, and we're not. I have some incredible friends who just pick me up whenever needed. You know I can just drop something into a group chat and go, oh, and they're all there. It's like, you know, just like Avengers Assemble type thing. One of them, her husband's just done the dirty on him. They've only been married 3 months. And literally I said, right, I've got lots of spades. I know I can get plastic sheeting, and I've got a big one. And someone else who's a teacher said, I know loads of 13-year-olds who are up for any crime. But that's what women are really like. We're not what we're told we should be. And when you look at the way that collectively, particularly actually if you look at some other cultures, the way that women collectively hold everything together, the way we're taught to be is wrong. And we're taught it from a very early age. So, in answer to your question, yes, unfortunately.
Thank you, Steph, for sharing your journey. It's really, eye-opening. I know that you did not mention, your strength and your resilience towards your journey, but it's clear, it's tangible in there that every time you get knocked down, you seem to be able to, bounce back. I was just wondering, what is there any specific kind of probably personal to you that you could share with us that every time you get knocked down, what is it that make you wake up the following morning ready to fight another day?
It hasn't always been like that. I have been close to depression on more than one occasion. I just skipped over that because we didn't have time. But yeah, I mean, kind of at the point that I decided I needed to get a hold of imposter phenomena, I just had a brain hemorrhage. I dumped the other half. I then threw myself back into work and was working even harder because I had to prove that even though I'd had a brain hemorrhage, I was still okay. And I worked myself to the brink of clinical depression. So yeah, it's not always, and I think it's really important that people recognise that. I now do quite a bit of stuff. I do lots of stuff that just enrich me. I talk a lot about life balance and that it's not, talk about work-life balance, it's like you've got work here and you've got life here. Well, my work is part of my life. And when work is really tough, I have to dial down other bits of my life. And when work is easy, but something else is tough, I have to kind of dial down on work a little bit. So I used to call it like an old-fashioned scales. It's a graphic equalizer now, because it's like got lots of sliders that you move up and down. But actually it's about finding things that fill you up. So it's a sink. Imagine a sink and there's no plug in it. So you've got stuff that's coming out all the time. That's just life. Stuff's going down the plug hole all the time. You've got to make sure those taps are turned on enough. For me, teaching dancing is one of the things that just nurtures me. I love dancing. I love teaching dancing. I have 2 dogs and a cat. Having a cuddle with them fills me up. I love tea. I mean, I love tea. My daughter says, "What's your death row drink?" It's tea. For me, having a big, over half a litre mug of tea in the morning and just enjoying that fills me up. So I have lots of things that are just the things that I look forward to and that fill up my sink, so that when stuff's going out, I can cope with it. And if that's really flooding out, sometimes I just say stop. And I'll cancel some of the stuff that I said I was going to do, and I just have, sometimes it takes a day. And I think there's something as well about when you're working things like EDI, you can be fighting all the time. When you care about this stuff online, you can be fighting all the time. I don't do that anymore. I know when I am tired, and I step back and have faith that other people will step forward. And then I've said it to others when they're online and you can see that they're getting really weary. I say, look, take a step back, I'm here. So it's not, nobody's superhuman. Nobody's as bouncy as a rubber ball. I like to think I am, I'm not.
Thank you. Thank you so much.
Thank you.